Hi, I'm Dr. Bob Donatelli. Today I'm going to do a little presentation on a brand new modality called the radial pressure wave from Storz Medical. If we look at the slide presentation that I put together, we'll give an explanation of what this modality does. All research based. First of all, it is an air compressor with a pulse wave generator. Again, a precision ballistic mechanism in the handpiece, because this projectile, which is accelerated by the compressed air, converts to kinetic energy. The projectile impacts against this immovable surface. The kinetic energy is then converted into sound energy. There are different acoustic impedance applicators which transmit the acoustic energy into the tissue, which we're going to look at in a minute. What is this? This is so critical because we're able to treat deep into the tissue, at the bone tendon area, which is the biggest problem with tendinosis and tendinitis. It's called endotheliopathy. The pain at the insertion of the tendon is an example of tendinitis, physical distortion of the cell, destruction of many intercellular components, and localized cellular and tissue damage. Sometimes it forms osteophytes because of this local damage. The bleeding out of the calcium into the area can create the bone formation. The radial pressure wave that we are talking about today, physiological effects are amazing. Upregulation of angiogenesis, what's that? Formation of new blood vessels. Local neovascularization and an increase in local blood flow. And then really critical is the tendon tissue converts the pulse wave stimulation into biochemical signals which release growth factors that upregulate biosynthesis. The biosynthesis is by tenocytes, which are elongated fibroblasts, and these develop gradually eventually into tendons. The collagen fibers that make up tendons, which is type 1 fibers, again from the fibroblasts. So again, if we inject hydrocortisone into this area, or if someone else does, it will kill the production of the tendons. It will prevent the fibroblast elongation to developing into these brand new tendons. Another two physiological effects, really good, are increased glycosaminoglycans or a synovial fluid, extracellular protein synthesis, indicative of early metabolic stimulus which accelerates the healing and regeneration. And then finally, increased fibroblastic proliferation in the activity and production of type 1 and type 3 collagen fibers, but making specifically where we're working, whether it be collagen for tendons or ligaments, basically the same thing, but we're trying to stimulate the production of type 1, type 3. There's a bunch of references that have proven that this works. A lot of good evidence-based information. And again, here is the handpiece. We can take this off. This is one that we just use for muscle trigger points. It can be used over large areas. This is a ceramic end piece, which you can see here. This one, if we attach it to this area, was used mostly for ligaments and tendons. We do not have to use a gel. On the other one, we use a gel just to absorb or prevent friction as I move the head. And the final one that I have, the other ones here, but these are the three main ones I use, is a gold tip, and this one goes deep into tissue for chronic pathology into that structures. So again, here is the hole through which the little pellet, looks like a little bullet, actually bangs into the surface of this, which is again creating this acoustic energy eventually from kinetic to acoustic energy. And again, if we then demonstrate it on a patient of mine, Brianna, she has a plantar fasciitis. So if I wanted to work the plantar fascia, we can use, in this area is ligamentous tissue, we could use the ceramic end, but we'll just use this. I can just work right into the trigger point, which again will sound like this. And again, not too painful, right? No. And I can leave it there. The total treatment time is in the device here, 2,000 impulses, which basically takes about 2 minutes. We can adjust, if we look at this handpiece, here is 2.5, that's the bar it's called, and we can increase that, as you see, to up to 5, a bar of 5, which is the deepest penetration of that tissue. We can also look at the hertz. I can adjust that. Okay, and so this has been an amazing tool for us to help heal tissue in the clinic with a lot of our patients, they come back for more and more visits because they see changes.